Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for returning. Speaking of returning, we're going to be speaking with returning guest and study author Steve Shak, Chief Medical Officer at Exact Sciences, returning to talk about some results presented at the San Antonio Breast Cancer Symposium concerning HR-positive and HER2 early-stage breast cancer. Thank you so much for coming back, Dr. Shak.
Thank you very much, Neil.
Well, give our listeners a bit of your background for those who may not be familiar with you when you were here before.
Yeah, I am a physician scientist. I've worked in collaboration with academic groups all around the world, first at Genentech for 15 years, and then now over 15 years at Genomic Health and Exact Sciences. And again, one of the things that we continue to focus on is this challenge that we all know is so important, which is how can we diagnose cancers and treat it smarter so that we can save more lives and reduce the toxicity and suffering from care.
HR-positive, HER2-negative breast cancer. How many women are diagnosed with this node-positive, hormone receptor-positive type of cancer every year?
Yeah, this group of women is the largest group of breast cancer patients. In the United States, approximately 270,000 women a year are diagnosed with breast cancer. And of those, 60 to 70% of them have HR-positive, HER2-negative breast cancer. Are
there a variety of treatments or a few?
Well, unfortunately, in the old days, in the last century, they're tended without tools such as Oncotype, the test that we're going to talk about. There was a one-size-fits-all approach. And most women who were diagnosed were treated with a combination of significantly tough therapies, including lots of surgery, often lots of chemotherapy, and also radiation therapy. The new news we're going to be talking about today, and it's evolved over the last 10 to 15 years, is that we can, with tests, now treat cancer smarter in a more personalized or precision way. And that was the big new news at San Antonio, was how the test has now been shown to identify that the majority of women with node-positive early-stage breast cancer now can be spared chemotherapy.
Now, I heard you mention Oncotype test strip. What exactly is this Oncotype test?
The Oncotype test is a genomic test that's done on the tumor tissue that's removed at the time of diagnosis, either by biopsy or by surgery. It looks at and reveals the expression or the profile of a set of 21 genes. And based on the analysis of those genes by the Exact Sciences Oncotype DX test, a score has been determined for every individual woman. And that score, the recurrence score, can then be used to help inform whether or not chemotherapy is of benefit or not.
Now, this is the data that was presented in San Antonio?
Yes. At San Antonio, a clinical trial result was presented from a study called the RxPONDER study. The RxPONDER study is one of the largest breast cancer treatment trials ever performed by the National Cancer Institute. The study began in 2010 and has now been reported, and its first results were reported just this past December at San Antonio.
Oh, Steve, would you kind of summarize the results from the RxPONDER study, some of the findings?
Yeah, the RxPONDER trial successfully defined the benefit of chemotherapy in early-stage node-positive breast cancer patients. They identified the fact that for women that have a score of 0 to 25, the majority of those women receive no benefit from chemotherapy. The study also helped to identify the minority of women in the study who, in fact, had a benefit of chemotherapy and therefore might consider the addition of chemotherapy.
Were there instances where chemotherapy and some other type of treatment were used in conjunction?
Yes. So all of the women in the study got treated with a standard for hormone receptor-positive breast cancer, which is with hormonal therapy. And so it's very important that women with HR-positive, HER2-negative breast cancer get treated either with a drug called tamoxifen, a hormonal therapy, or one of the several aromatase inhibitors. The study, though, was specifically designed, since many women are now all treated with chemotherapy, thinking that it benefits everyone. The study was designed to try to identify, was there a large group of women who in fact could get excellent results with either tamoxifen or aromatase inhibitor alone. And so, that was the major practice-changing result of this trial. It's really now a revolution in treatment. Not every woman with node-positive breast cancer needs to have chemotherapy added to their treatment program.
Would you say that there will be a huge decline in chemotherapy because many of them will be deemed as unnecessary based on this study? Yes,
absolutely. Doctors and patients want to take the therapies that are shown to have benefit to them. And in fact, as I indicated before, when the recurrence score is high in both node-negative and node-positive breast cancer, then it's very clear that there's a large benefit of chemotherapy. And although women in general don't want to take chemotherapy, in this particular case, the benefits of it outweigh the risks. But again, based on the responder results and the previous trial done by the NCI, the TAILOR-X trial, when the recurrence score is low for the majority of women, there is observed no benefit from chemotherapy.
Well, Steve, where can our listeners go online and get some more information about the Oncotype DX test and about the responder study as well, and also about Exact Sciences too?
Yeah, so with regard to information about the Oncotype DX test, go to oncotypeiq.com. That's ONCOTYPE, IQ.com. And there's information there, a lot of information both on the breast cancer test as well as the other Oncotype tests for prostate cancer and other tumor types. With regard to Exact Sciences, go to exactsciences.com. And again, there's information also on some of the very new programs, and as well as the whole area of screening for cancer, and information about Cologuard, the leading colon cancer screening test. And then finally, with regard to the SWOG study, and that's the responder trial that was done by SWOG or the Southwest Oncology Group, you can go to their website and search for SWOG and go to swog.org, I believe.
Great.
Thanks very much.
Great. Well, I appreciate you joining us. Thank you.
Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.